Hello, I am Nurse Ruben Marcus Draghi, your public health nurse as well as your favorite nurse. Today I'll be speaking on infection prevention control, implication on quality healthcare delivery. So infection prevention and control is a crucial evidence-based approach to safeguarding patients, caretakers, visitors, and healthcare workers against preventable infections. That's according to WHO in 2023. So infection prevention control is very important aspect of quality healthcare delivery because almost all what we do or the care we are giving entails this IPC, and we need to do it. We cannot do it without involving infection prevention. So WHO again defined IPC as a scientific approach and practical solution designed to prevent harm caused by infection to patients and healthcare workers. Infection prevention control interventions encompasses a wide range of activities, including hand hygiene, use of personal protective equipment, environmental cleaning and disinfection, safe injection practices, and waste management. That's what we call healthcare associated infection. So these are bacteria responsible for the cause of what infection. That's after arrival of patient, like 48 hours in the hospital, and these bacteria are gotten through care or process of care. So it could be like Staphylococcus aureus, Escherichia coli, and Pseudomonas aeruginosa. So we have chain of infection. That's how this infection move, or how they contract from one person or move from one person to the other. We have what we call pathogen. These are the bacteria, the microorganisms. It can be bacteria, virus, fungi, or parasite. So we have a reservoir. Reservoir, it's just like a well where these microbes are found. So it can be people or healthcare workers, patients, food and water. And we have portal of exit. That is a channel through which these bacteria comes out from the reservoir, so to be transmitted to other places or to the susceptible host. So we have a mode of transmission, which is, it could be like direct contact or indirect contact. Direct contact, that's when you are having like direct contact with the patient. Indirect, when you have when you touch something that the patient used or touch. And also portal of entry, that is a channel through which this microorganism get access into your body or the body of the susceptible host. And the susceptible hosts can be patients, healthcare workers, and visitors in this case. So the transmission in terms of humans, that's why in the hospital, environment, medical devices, lining, and clothes. So under the humans, we have patient, staff, caretaker, and environment. We have room, surface, air, and water, while medical equipment through the sterilization process and laundry. So we have component of IPC, that's infection prevention control. Standard precaution is one of them, which includes like hand hygiene, personal protective equipment, respiratory hygiene, safe injection, and transmission-based precaution, which is applied to isolation cases. It can be airborne contact or droplet. We have high-risk aseptic procedures. We have hand hygiene, which has the moment and the steps of hand hygiene. The moment is 5. We have before touching the patient. We have before clean or aseptic procedure. We also have after exposure to body fluid. We have after touching the patient or after touching the patient's surrounding. So saying that we have sterilization, that's a disinfection of equipment, medical equipment used in the hospital. We have waste management, that's segregation of waste from where it is generated to the treatment, that's end point of the waste. So we have environmental hygiene, which has to do with the cleaning of the walls and tables and all the things. So the impact of IPC. Impact of infection prevention control, it has impact on patient. It reduces the length of stay, the cost, and all the burden of disease. And it is also important in reducing what healthcare associated infection through cutting the transmission of this infection. But there are challenges we have in implementing or promoting infection prevention control, and these challenges can be due to barrier to compliance with IPC guideline. We have limited resources in most hospitals and inadequate staffing. So we have challenges in monitoring and surveying. Though IPC is not being monitored as expected, there is another one is resistance to change, which is directly related to human behaviors. And going by that, we have strategies of how to overcome that multi-disciplinary approach, that coming together as a team to approach the infection prevention control. We have active engagement of healthcare workers and patients. That's through what follow-up and support, adequate resources and staffing, and continual education and training, most especially bedside and reminder, regular monitoring and feedback using the IPC monitoring tools, which are hygiene observation tools, environmental cleaning audit tools, personal protective equipment audit tools, and IPC program evaluation tools such as transmission-based precaution audit tool and catheter-associated urinary tract infection audit tool. So, role of what? Healthcare workers, that's doctors, nurses, lab scientists, and pharmacists and others in promoting infection prevention control. So, first of all, they should lead by example. That means doing those or implementing those IPC measures. And aside that, educating patients and their families in regard to infection and its prevention and control. And also monitoring and enforcing guidelines with the use of the tools and participating in IPC programs like hand washing day. So in summary, IPC is an essential aspect of quality healthcare delivery. So proper implementation of infection prevention control measures can reduce the incidence of hospital-acquired infection, improve patient outcomes, and promote the well-being of healthcare workers and the community and also the patient. Thank you very much. Thank you, sir. Yeah. Thank you, sir.
Like it. Like it.
What does it like, sir?
Ah, you're not